Today we're going to do the top 3 exercises for the iliotibial band, also known as the ITB, I, ilio, T, tibial, B, band. Iliotibial band runs from the hip down below the knee. We'll go into that a little bit later. Exercise number 1 is this. You need a foam roll for this. If you're a runner and you have a lot of outside knee pain from iliotibial band issue, you're going to want to invest in one of these. They're probably anywhere from $15 to $20 in your area. So first exercise is this. You can do it on the floor or on a mat table like this. One leg supports you. So in this instance, this is an exercise for the right side, the right iliotibial band. I'm laying on my side, supporting myself, doing a little plank. Start the roll right here, roll the whole way down to the knee, out to the hip. In the clinic, we just do this for time. Might do 30-second to 1-minute bouts, depending on what the person can tolerate in the beginning. Whole length of the iliotibial band. We want to break up any sort of scar tissue or tightness that might be there. Exercise number 2. You're going to lay on your back. So if we want to stretch the right iliotibial band, we're going to bring the knee. Start at 90 degrees, and then you can play around with it to see with the structure of your body what exactly the best angle is to get a stretch in the iliotibial band. So what you're going to do is to stretch the right side, right knee's up, grab the outside of your knee with your left hand, the opposite hand, pull across. And then what you can do from here is play around. Drop your knee down lower. You're probably going to feel it a little more on the outside of your leg here. That's what you're shooting for. If you're bringing it up higher, you're going to go into the buttocks, more of a piriformis stretch. So you want to drop it down to where you can feel it on the outside of your leg the best. Pull across, hold for 30 seconds. In our clinic, we do it 3 times. Exercise number 3. Because the iliotibial band, ilial literally means it's a bone in the pelvis. So your pelvis is made up of a bone called the ilium. There's another one called the pubis, and another one called the ischium. They're fused together to form one half of your pelvis. The ITB, the iliotibial band, attaches to right here. It's called the iliac crest, big fancy name. But what can happen is you can have an underlying pelvic issue, especially if you get back pain right here. You can have an underlying pelvic issue that puts extra stress on that iliotibial band. So the third exercise is to actually get your pelvic area screened either by your doctor, your chiropractor, or my preference, your physical therapist, to see if there's an underlying problem there. Runners that we see with that long-standing outside of the knee pain or outside of the hip pain, which is usually attributed to bursitis or ITB friction syndrome, most often have an underlying pelvic issue. You want to make sure you get that screened, taken care of, and then, if the top 3 exercises for your pelvis or top 3 exercises for the core might be the thing that are most appropriate there. Top 3 exercises for quick anatomy lesson on ITB syndrome. Iliotibial band runs from the iliac crest. So this is looking at the front. You'd have your tailbone right here, your lumbar spine, your low back. Directly above that, ITB connects to your iliac crest, which is right here. On the outside of your pelvis, this area right here, right about your hip, runs down past this critical area right here on your femur, which is the outside of the hip. That's the area common for trochanteric bursitis. Most people just know it as hip bursitis, but that happens right here. And then it also connects down below your knee joint on the outside of your shin bone called your tibia. So you can get, they call it ITB friction syndrome or outside of the knee pain, especially common with running, down here below the knee joint, and that trochanteric bursitis or hip bursitis right here. Top 3 exercises for ITB friction syndrome will help you handle those areas.